Hey everybody, good morning. This is Nurse Eunice with Florida Training Academy, and in today's video, we're going to review medical surgical nursing. And so this is our practice test. You're going to enjoy it, and as we do in each of our videos, we'll give you about 10 seconds to receive your notifications. Hey, future nurses, welcome to your Med Surg Nursing Practice Test, a quick and powerful way to test what you know and boost your confidence before the big exam. Whether you're in nursing school, prepping for the NCLEX, or just need a solid Med Surg refresher, you're in the right spot. So what is Med Surg Nursing? Med Surg is short for Medical Surgical Nursing. It's the heartbeat of the hospital. It's where nurses care for patients with a wide range of health conditions, from recovering surgery patients to those with chronic illnesses like diabetes, heart failure, or infections. You never know what you're going to see next, and that is what makes it so exciting. I love this image. This is one of our nurses. Hey, she actually came down to take our NCLEX and nursing clinical refresher course. So we have a skills lab where if you are just re-entering the workforce, or maybe you failed your NCLEX multiple times and you haven't been practicing your hands-on skills, we offer a safe place right here in Jacksonville, Florida. And yes, we have nursing students and nurses who travel from around the world to attend our courses. So our website is fltraining.com. But let's get back to those med surg nurses, because they are the multitaskers, the problem solvers, and true patient advocates. You'll give medications, change dressings, monitor vital signs, insert urinary catheters, communicate with doctors, and educate patients all in one shift. Think of it as the perfect mix of hands-on care and critical thinking. This is where you learn the basics. All right, so let's prepare for our 50 practice question, our little mock exam. Here's how it works. I'll ask questions, you'll pause and think, and then I'll break down a correct answer with a simple, no fluff explanation. So grab a pen, take some notes, and let's make this fun and stress-free. That's the Florida Training Academy way. And so, of course, this review is brought to you by me, Nurse Eunice, and Florida Training Academy, where we help caregivers and nurses like you succeed. If you haven't done so, go ahead and subscribe to our YouTube channels. We have one that is Florida Training and another one that is my personal name, Eunice Mathis. These are some more of my nurse babies in our nursing skills lab. That's right. And so she's relearning her skills on how to suction a patient with a trach. So I also review trach skills too. And so now we're at question number 1. So question number 1, a patient with COPD, which is chronic obstructive pulmonary disorder, is receiving oxygen via a nasal cannula at 4 liters per minute. The nurse should do which of the following? A, continue therapy as ordered. B, reduce the flow rate to 2 liters per minute. C, switch to a non-rebreather mask. Or D, call respiratory therapy for suction. All right, and this is rapid fire, so revealing the answer in 3, 2, and the correct response is B. Remember, if someone has COPD, higher oxygen levels can actually suppress their respiratory drive. And so the goal oxygen rate for them is usually 1 to 2 liters per minute. That is the typical recommendation. Question 2, which lab value is most important to monitor in a patient receiving furosemide, also known as Lasix? Would it be sodium, hemoglobin, chloride, or potassium? Your patient has, in order for Lasix, what labs do you need to monitor before and after? And if you chose D, potassium, great job, because furosemide can cause potassium loss, increasing the risk of arrhythmias. So whether the potassium levels are low or high, both of which can cause cardiac issues. Question 3, a patient with a new colostomy is crying and refuses to look at their stoma. The nurse's priority action is to A, leave them alone for privacy. B, provide stoma care education. C, acknowledge their feelings and offer support. Or D, ask them to help clean the stoma. All right, this should be an easy one for you. because you all show empathy. And so you know the correct answer is going to be C, because you have to provide the emotional support. If she's stressed and she's crying, she has the body image disturbance because now she has a stoma, she has fecal matter escaping her body from her stomach area, you have to provide that emotional support. Otherwise, she will be in no state of mind to actually retain the knowledge that you're trying to provide to her. So once her emotions are under control, she'll be better able to participate in the care of her stoma. Question 4. Which is the earliest sign of hypoxia? Would it be confusion, cyanosis, bradycardia, or clubbing? The earliest sign of hypoxia. Revealing the answer in 3, 2, and 1. And if you chose A, you got it. So cyanosis, changing blue, that's late stage. So if your patient who was previously coherent, especially if they're post-op, if they are now confused, you want to be doing a full set of vital signs, including checking the oxygen level, because hypoxia or oxygen level less than 94% could cause confusion. So mental status changes such as confusion or restlessness often appear before visible signs like cyanosis. Question 5. You walk into a room and find your post-op patient short of breath with unilateral chest expansion. What do you expect? Is it atelectasis, pulmonary embolism, pleural effusion, or pneumothorax? Unilateral chest rise. Only one side of their chest is rising and falling. And if you chose D, you have it correct. So unequal chest expansion and sudden onset of difficulty breathing, dyspnea, are hallmark signs of a pneumothorax, which occurs when air enters, air leaks into the space between the lungs and the chest wall. This causes part or all of the lung to collapse, preventing proper inflation. Question 6. A patient with type 1 diabetes is found confused, diaphoretic, and shaky. What should the nurse do first? Would it be A, check the blood glucose, B, notify the physician, C, administer insulin, or D, call the rapid response team? And I know a lot of our viewers are CNAs, and so we are helping to prepare you for nursing school, for your nursing exams, and then once you get to the end of your program, to help you pass your NCLEX. And so the answer to question 6 is A. Right. So we need to actually, when you call the doctor, you need to have some objective data to give the doctor, not just that your patient is confused or sweaty. So it's going to be plus their blood sugar is 36. So you need to go ahead and have that blood sugar reading before you call the provider. So the symptoms, of course, suggested hypoglycemia. You need to confirm that with a blood sugar check before intervening. Based on the patient's presentation, we may be able to give a sugary substance like orange juice orally. But if the patient is unresponsive or confused, that nurse may need to start an IV and give dextrose intravenously. Question 7. The nurse is caring for a post-op abdominal surgery patient who hasn't passed gas in 2 days and reports bloating. What should the nurse suspect? Would it be A, GI bleed, B, constipation, C, paralytic ileus, or D, hernia? All right, revealing the answer in 3, 2, and it would be C, you all. So remember that anesthesia puts the organs to sleep. So it just doesn't put the person to sleep, it puts the organs to sleep also. So lack of bowel sounds or the absence of gas after surgery, especially 2 days later, may indicate paralytic ileus. It's a temporary cessation of intestinal movement. There's no peristalsis. This condition is common after abdominal surgery due to anesthesia, pain medications, especially opioids, or manipulation of the intestines during the procedure. And so if you've learned something new, put a 1 in the chat. All right, we appreciate you. Question 8. In a patient with chronic kidney disease, which lab value is most concerning? You have to know your lab values if you're going to be a nurse, if you're going to pass your NCLEX. So would it be a potassium of 6.2, a potassium of 3.5, a sodium of 135, or a calcium level of 9.2. So which value is critical? Which value needs to be reported to the physician right away? And if you chose A, you're amazing. So, rationale. Elevated potassium is referred to as hyperkalemia. It is a life-threatening situation, especially in patients with chronic kidney disease or CKD, because their kidneys cannot excrete potassium efficiently. This can lead to dangerous cardiac arrhythmias, muscle weakness, or even cardiac arrest. Remember that your normal potassium range is 3.5 to 5. Levels above 5.5 are considered elevated. Levels above 6.0 are considered critical and require immediate intervention, such as cardiac monitoring, IV calcium, insulin with glucose, or maybe they need an early or a stat dialysis treatment. CKD patients are at high risk, so even mild elevation should be taken seriously. Question 9. What is the priority nursing action when caring for a patient with a chest tube? Would it be A, milk the tube every hour, B, keep the drainage system above chest level, C, clamp the tubing when transporting the patient, or D, monitor for continuous bubbling in the water seal chamber? All right, so your patient with the pneumothorax now has a chest tube. And what are you monitoring for? What is your priority nursing action? And if you chose D, you're absolutely correct. So if you see continuous bubbling, that indicates that there's an air leak. You need to reassess your patient and then reassess your pleurovac or your chest tube system. Question 10. A patient reports new numbness and tingling post-thyroidectomy. The nurse should A, offer reassurance, B, assess the Chvostek's and Trousseau signs, C, recheck blood pressure, or D, administer IV fluids. Numbness and tingling after having their thyroid removed. Revealing the correct response in 3, 2, and if you chose B, you understand that hypocalcemia can occur after the thyroid is removed because the parathyroid glands, which regulate calcium levels, may be accidentally damaged or removed also. So low calcium levels would be the ones that's causing the nerve and the muscle function issues. And so usually after a thyroid surgery, we're checking for 2 classic signs to see if your patient has hypocalcemia. The first is a Chvostek sign. That's when tapping on the face can cause facial twitching. And the other will be Trousseau sign, and that's inflating the blood pressure cuff on the arm. And if the hand starts to contract, there will be carpal pedal spasm. That will be another sign of hypocalcemia. Of course, you're going to go ahead and confirm that. You're going to call the doctor to get a lab order. But as a nurse, you need to be monitoring for those signs and symptoms. Question 11. A patient with liver cirrhosis is confused and has tremors. Which lab value correlates with these symptoms? Would it be A, high ALT, B, high ammonia, C, low bilirubin, or D, low potassium? All right. Liver cirrhosis, which lab value, if it's high or low, would cause confusion and tremors? And yes, it is B, it's ammonia. So elevated ammonia levels cause hepatic encephalopathy, which some of the symptoms would be confusion, tremors. Those are a key sign. And don't forget that whenever your patient has liver disease or hepatitis, they can have the yellowing of the skin as illustrated in this image. Question 12. A patient post-hip surgery has sudden shortness of breath and chest pain. What should the nurse do first? A, administer morphine, B, call the physician, C, check oxygen saturation and apply oxygen, or D, reposition the patient. Post-hip surgery, sudden shortness of breath, and chest pain. You are immediately thinking about a blood clot that has traveled. So it's going to be C. The symptoms suggest a pulmonary embolism. Remember, if someone has a long bone surgery, a side effect of that could be a clot that dislodges and then travels. So whenever you think about somebody having chest pain and shortness of breath, you're thinking about a pulmonary embolism, especially post-op. Oxygenation comes first, followed by provider notification. So sit them up, apply oxygen if it's ordered, call the doctor, and then they can get extra tests ordered for that particular patient's care. Question 13. A patient with chronic heart failure has gained 5 pounds in 2 days. What is the nurse's priority? A, call dietary services. B, administer Lasix. C, encourage walking. Or D, assess lung sounds and report findings. Okay, so we know a person has chronic heart disease. Their heart's failing. That means the heart is not able to pump the extra fluids. So sometimes they will cause pedal or leg edema, or you can start hearing the coarse crackles in their lungs. So this person has gained 5 pounds of fluid in 2 days. What is the nurse's priority? And it's going to be D. You listen to those lung sounds. Remember, when you call the doctor, you have to give the doctor some information besides they gained 5 pounds in 2 days. It's going to be, how is this patient presenting? What are the vital signs? What do they sound like? So the doctor will know how much Lasix to provide. So sudden weight gain suggests fluid retention. Assessing for pulmonary edema, those crackles, is essential. And then after that, you would relay your findings to the physician. Question 14. Which order would the nurse question in a patient with increased intracranial pressure, or ICP? So let's say this patient was in a motor vehicle accident, they sustained head injury, and so now they have swelling inside of their skull. Okay, so intracranial pressure. Which of the following would the nurse question? In other words, which would be an order that would seem inappropriate? Would it be A, have the head of the bed at 30 degrees. B, administer mannitol IV. C, monitor neural checks hourly. Or D, encourage coughing and deep breathing. Excuse me. And if you chose D, you are correct. You all, like how I just coughed, that would be increasing pressures. So we do not want to encourage them to cough and deep breathe, because that's going to increase their ICP. So usually when a person has had head trauma, or if we're on ICP precautions, we're going to keep their head of the bed no higher than 30 degrees at all times. That allows the fluid to drain down. We don't want them sitting too far up, and we definitely don't want them flat. So coughing increases ICP and should be avoided unless absolutely necessary. Question 15. What is the priority assessment for a patient receiving IV potassium chloride? Pain at the IV site, heart rate, urinary output, or respiratory rate? All right, so if a person's receiving IV potassium, we like to say no K as in KCl without P as in urine. So we're monitoring urine output. So potassium should never be given without confirming kidney function, because the kidneys are responsible for excreting the excess potassium. Remember, if they become hyperkalemic, they can go into cardiac arrest. So no K without P. If the kidneys aren't working, potassium can build up in the blood, causing life-threatening arrhythmias. So always check for adequate urine output, which is at a minimum 30 mLs or cc's per hour before giving potassium to ensure the kidneys are functioning. 16, and we're going all the way to 50. 16, which nursing action is most appropriate after administering sublingual nitroglycerin? Would it be A, document the administration, B, recheck the blood pressure in 3 to 5 minutes, C, call the cath lab, or D, have the patient lie flat? Which nursing action is most appropriate after administering sublingual nitroglycerin? What effects would nitrates have on the patient's body? And if you said dilation, which can cause the blood pressure to drop, you're absolutely correct. It is B team. So nitroglycerin causes vasodilation. And after you administer it, before and after it, because you never want to administer sublingual nitroglycerin to someone who already has a low blood pressure. So nitroglycerin can cause the blood pressure to drop. So you want to always reassess. Those vital signs are so important. Question 17. A patient with pancreatitis is experiencing severe epigastric pain and has elevated serum lipase levels. The nurse should anticipate which of the following. Would it be A, NPO orders and IV fluids, B, high protein diet, C, ambulation to relieve gas, or D, blood transfusion? Right? Pancreatitis. So the pancreas is inflamed, usually due to an infection. The patient's having severe epigastric pain. What do you anticipate? Yep, that patient's going to be NPO. They may need surgery. Their bowels need time to rest. So pancreatitis is managed by bowel rest, NPO status, pain control, and fluids to reduce inflammation. So you would go ahead and put the sign above, of course, educate your patient, but put the sign in the room and then take out the water pitcher, etc. Because we don't want a person who's vomiting, whose stomach is irritated or their pancreas is irritated to actually consume more food or fluid, which is going to make their vomiting worse. Question 18. Which ECG change is associated with hyperkalemia? Would it be ST depression, prolonged QT interval, peaked T waves, or absent P waves? All right, so revealing the answer in 3, 2, and the answer is going to be C team. So peaked T waves are hallmark signs of hyperkalemia. And so when you look at the QRS complex, it's followed by a peaked T wave. So QRS, and then we have where the arrow is, that is abnormally high for a T wave. Sometimes T waves are not even present. So if you see one present and it's just as high as the tip of your QRX complex, that would be a sign of hyperkalemia. Monitor their cardiac status closely and, of course, notify the provider. Question 19. A diabetic patient with a foot ulcer is found to have a blood glucose level of 445 and ketones in their urine. What should the nurse do first? A, recheck the blood sugar in 1 hour. B, encourage oral fluids. C, start IV fluids as ordered. Or D, call the provider and request an order for sliding scale coverage. All right, so their blood sugar is high. They have ketones in their urine. That's a sign of uncontrolled diabetes. What are you going to do first? And if you chose C, you're right. The doctor already gave you orders. You just need to go ahead and implement them. So a blood glucose of 445 with urine ketones suggests diabetic ketoacidosis or DKA, a life-threatening emergency. The first priority is to begin the ordered IV fluid replacement to correct dehydration, improve perfusion, and lower glucose levels. A lot of times your patients who are in DKA, they won't be receiving their sliding scale coverage alone. Your doctor may also order IV insulin. So that's why after you replace the fluid, after you hang the fluids that were ordered by the doctor, you will continue to monitor their blood glucose levels and then follow up with your physician to see if another order is needed. Question 20. A patient with peritoneal dialysis reports cloudy outflow and abdominal pain. The nurse should A, notify the provider of suspected urinary infection, B, notify the provider of suspected peritonitis, C, clamp the catheter, or D, flush with 1 liter of saline. All right, so peritoneal dialysis. The output is cloudy. All right, and the nurse should do the following. It would be B, okay? So we call it effluent. So once the dialysis solution, that the dialysate, it goes in, it helps to clean out that peritoneal space. And then the waste, the effluent, it's not urine, it's a fluid. That is what falls into the lower back. So cloudy peritoneal dialysis, effluent, and abdominal pain are classic signs of peritonitis, a serious and potentially life-threatening infection of the peritoneal cavity. This complication requires immediate intervention, including notifying the provider, sending the effluent for culture, and starting prescribed antibiotics. As a nurse, remember, we never start antibiotics without getting that culture first. So make sure that, I don't care what's going on with your patient, if there is an order for a culture and an order for antibiotics, you get that culture before you start that antibiotic. Prompt treatment is essential to prevent sepsis and preserve the peritoneal membrane function. Question 21. A patient with a DVT is started on heparin. What is the most important lab to monitor? Would it be A, which is PTINR, B, platelets, C, PTT, or D, hemoglobin? Which lab value is associated with heparin? And if you chose C, PTT, you are right. So PTINR, that's associated with warfarin, okay, the oral anticoagulant. PTT is associated with heparin, which would be intravenous. So PTT, or partial thromboplastin time, is used to monitor heparin therapy effectiveness and safety. Question 22, a patient with an NG tube, which is nasogastric tube, on suction has potassium level of 2.8. The nurse should A, pause the suction and administer potassium via the NG tube. B, hold the next feeding. C, irrigate with saline. Or D, notify the provider and anticipate potassium replacement. All right, so if you recall from our previous slides, a potassium level of 2.8 is low. So we know we have to replace it, but how do we replace it? Would it be A or would it be D? And if you chose D, you are right. We're not going to pause their suction to administer potassium. Number one, potassium irritates the stomach lining. And if this person doesn't have anything on their stomach, that would make them vomit. So we're not going to pause it. We're going to do D instead. We're going to continue their NG suction because it is ordered. But just know that NG suction can cause electrolyte imbalances. And so your doctor will have to be notified, and more than likely that person will be receiving intravenous potassium replacement. Question 23. A post-thyroidectomy patient begins speaking hoarsely and has stridor. Stridor is abnormal, you all. What is the nurse's action? Would it be apply oxygen, check the calcium level, notify the rapid response team, or place the patient in Trendelenburg? Right. Revealing the answer in 3, 2, and it would be C. So hoarseness, especially stridor, after a thyroidectomy may indicate airway compromise due to swelling, bleeding, or laryngeal nerve damage. Stridor, a high-pitched, noisy breathing sound, signals partial airway obstruction, their airways closing. That's a medical emergency. Immediate action is required to maintain a clear airway, including notifying the provider, preparing for possible intubation, and monitoring those oxygen levels. Question 24, which finding in a post-op patient should be reported immediately? Would it be a urine output of 15 mLs per hour, saturation of 93% of room air, blood pressure of 100/60, or a pain score of 7 out of 10? We'll give you about 5 seconds. All right, and so remember, those organs go to sleep. And so if a post-op patient has urine output less than 30 mLs per hour, that's a red flag that the organs may be hypoperfused. That's an early sign of renal failure. So the correct response is A. This could be due to blood loss. Maybe they nicked an artery, dehydration, or shock. Prompt assessment is needed to evaluate fluid status, blood pressure, and kidney function, and to notify the provider immediately for possible intervention. Question 25, which of the following task is appropriate for delegation to a CNA? Would it be administering enemas, ambulating a stable post-op patient, assessing a pressure ulcer, or teaching about incentive spirometry? All right, and this one should be easy for you all because you know that the nurses do the first teaching. So your RN is going to teach. So your CNA can remind, but you can't be D. So a process of elimination, what the CNA could do would be to ambulate a stable patient. The assessments and teaching, those are all your RN duties. 26, a patient with chronic renal failure is receiving epoetin alpha. Which finding would indicate a therapeutic effect? Would it be the hemoglobin increases? We have increased urination, reduced creatinine, or decreased potassium. All right, and so anytime a patient's receiving epoetin, we know that it's going to be A. We're given this medication because they are anemic. So epoetin stimulates RBC or red blood cell production. It raises the hemoglobin levels in patients with anemia of chronic disease. Question 27. A patient receiving vancomycin develops redness, flushing, and itching of the face. What should the nurse do first? A, ask the patient about their history of allergies. B, assess for anaphylaxis. C, slow the infusion rate and notify the provider. Or D, stop the infusion immediately. All right, so someone's receiving an antibiotic, they become flushed, they're red, and now their face is itchy. What do you want to do? And if you chose D, you understand that according to the Infusion Nurses Society standards of practice, when a patient exhibits signs of an adverse reaction during an infusion, the first step is to stop the infusion immediately to prevent further administration of the suspected causative agent. Then second, assess the patient. And then third, notify your provider. So I know they changed the term. It could be like vancomycin reaction now, but an old term was red man syndrome. It's a non-allergic histamine reaction that can occur when vancomycin is infused too quickly. Symptoms include flushing, rash, itching, and also hypotension. Especially the rash and the itching would be on the face, the neck, and the upper torso. So you just slowing the rate doesn't help this patient whose blood pressure is dropping. You need to stop the infusion, monitor your patient, and then call the doctor. Question 28. Which patient should the nurse assess first after shift report? So let's talk about prioritization. Which patient would you assess first? Would it be A, a post-op cholecystectomy patient requesting pain meds? B, a COPD patient on 2 liters of oxygen with a respiratory rate of 22? C, a diabetic patient with a blood glucose of 70? Or D, a CHF patient reporting difficulty breathing when lying flat? Oh, and we know that was easy. We know our prioritization. We know which patient we're going to see first. And the person who is short of breath is the one that's going to be seen first. Remember ABC, airway, breathing, circulation. So this person's the priority. Orthopnea, or shortness of breath when laying flat, is a red flag for fluid overload and potential respiratory distress. Requires immediate assessment, such as elevating the head of the bed, listening to those lung sounds, and then if the person has oxygen orders, maybe a breathing treatment, that would be some of the other sometimes standard orders that a patient may have, especially if they have long-term or chronic lung disease. Question 29. What is the expected outcome of administering lactulose to a patient with hepatic encephalopathy? Would the expected outcome be increased appetite, potassium retention, decreased ammonia levels, or reduced bilirubin? So think about that image where the person had the yellowing of the skin. When they have hepatic encephalopathy, it was what level were we monitoring? All right. And so if you chose C, I apologize, you are correct. And so lactulose is going to cause the patient to have a bowel movement, which is going to remove that excess ammonia. So lactulose helps to excrete excess ammonia via the stool. It is not stomach friendly, okay? But once they have lower ammonia levels, usually their confusion and their tremors will decrease. So it improves their cognitive symptoms. Question 30. Which electrolyte imbalance increases the risk for digoxin toxicity? Would it be A, hypernatremia, B, hypokalemia, C, hypermagnesemia, or D, hyperphosphatemia? All right, so someone has an electrolyte imbalance. Which of the following would predispose them to DIG toxicity? And it's going to be B. So low potassium levels would cause the digoxin's effect on the heart to be enhanced, thus increasing the toxicity risk. Question 31. A patient with a blood transfusion begins to complain of chills, fever, and back pain. What is the nurse's priority? Is it to check the vital signs, notify the provider, stop the infusion, or slow the infusion rate? And I know you all remember the quote that I showed you from the Infusion Nursing Society. So you know the answer is going to be C. We're going to stop that that transfusion, because everything that we showed in the previous slide would be signs of a transfusion reaction. You're going to stop the blood transfusion immediately. And then usually there's going to be a second line with saline. You're going to go ahead and open that. So we're going to give them additional fluids. And then of course, you're going to monitor your patients, like vital signs, every 3 to 5 minutes, and you're going to be in that room with that patient for at least 30 minutes. You can call the provider, the doctor from inside the room. A lot of your facilities will have standing orders. So if you're giving someone a blood transfusion, a standing order would be what to do if they start having a reaction, but you still have to notify the provider. And then everything, the blood, the tubing, all of that gets sent back to the blood bank so that they can actually investigate and see if there was something, maybe we hung the wrong blood, but you don't throw any of that away. It goes back to the blood bank. Question 32. Which condition is most concerning in a patient taking metformin? And so metformin is an oral anti-diabetic agent. So if they're taking metformin, should you be concerned about a scheduled CT scan with contrast, diarrhea, elevated blood glucose levels, or morning headache? All right, and I hope you're taking notes. I hope you're learning a lot. And so for question 32, anytime a patient's taking metformin, you have to be worried about that kidney function. So metformin, when combined with IV contrast or dye, increases the risk of lactic acidosis, a rare but serious complication. Because the contrast can temporarily affect kidney function, metformin should be held for 24 to 48 hours before and after the procedure, or until kidney function is confirmed to be normal. This precaution helps to prevent the buildup of lactic acid in the body. So if your patient who's a diabetic is on your cardiac floor because they have to have a cardiac procedure, a cardiac test, if that test includes IV dye, you're going to call that provider to remind them, because the cardiologist may not be aware that this patient's taking metformin. You're going to have to call the cardiologist to let them know about the metformin so it can be held. That may delay the test, but we'd rather delay the test than cause damage to their kidneys. Question 33. A patient develops facial droop and slurred speech. What is the nurse's immediate action? Is it A, perform a stroke scale, B, check blood glucose, C, call the provider, or D, activate the stroke alert code? All right, facial droop, slurred speech. Your patient did not have that before. You all were calling a code. It is going to be D because time is brain. You're going to initiate the stroke protocol immediately for rapid assessment and treatment. So signs of a stroke include face drooping, arm weakness, speech difficulties, or the slurred speech. If you're outside of a hospital system, you're calling 911. If you're inside of a hospital, you're going to go ahead and press the code button. Of course, once the team gets there, that's when we can just circle back and also check the blood glucose level. Because if a patient has hypoglycemia, that too can mimic the symptoms of someone who may have had a stroke. But again, time is brain. We'd rather you call the code than not call the code. Question 34. What is a priority intervention for a patient with neutropenia? Is it A, encourage frequent ambulation, B, provide fresh fruit, C, limit visitors and monitor for infection, or D, apply heating pads to sore joints? All right, so in order for you to answer this, you have to know what neutropenia means. And so if you answered C, you are right. This person is going to be placed on reverse isolation because we as the healthcare providers can give them infections because they cannot fight the infections. They are immunocompromised. So neutropenic patients are immunocompromised, and so we have to reduce the infection exposure. So we glove and gown up and mask up before we enter their room, not because they're giving something to us, but because instead we can actually give them something. Question 35. A patient with Addison's disease presents with fatigue, low blood pressure, and bronze skin. What is the expected treatment? Would it be insulin, hydrocortisone, calcium gluconate, or vasopressin? What do you recall about Addison's disease? All right, and so if you think about the endocrine system, you know that with Addison's disease, we're going to be given hydrocortisone. So Addison's disease is a disorder in which the adrenal glands do not produce enough corticosteroids, particularly cortisol and sometimes aldosterone. These hormones are essential for regulating metabolism, blood pressure, and the body's stress response. Because of this deficiency, replacement corticosteroid therapy like hydrocortisone or prednisone is the main treatment. This therapy helps restore hormonal balance and prevents life-threatening conditions such as adrenal crisis. All right, number 36. Which symptom would be most concerning in a patient post-cardiac cath via the femoral approach? Would it be a weak femoral pulse? Would it be a PT-INR level of 1.0? Would it be numbness in the wrist? Or would it be urinary retention? All right. Which symptom would be most concerning in a patient post-cardiac cath in which they use the femoral approach? And ding, ding, ding. That's right. We're checking those pedal pulses. So it's going to be A. And so before cardiac catheterization, of course, you want to check the pulses, and then definitely afterwards, you want to check the pulses also so you can compare. And so if this pulse is now weaker, that would be concerning because it may indicate compromised circulation to the affected leg. This can be due to arterial damage, thrombosis, hematoma, or embolism, and it requires immediate assessment and intervention to prevent permanent tissue damage or limb ischemia. Number 37, a patient with atrial fibrillation is prescribed warfarin. Which INR value should the nurse report to the healthcare provider immediately? Would it be an INR value of 1.2, 2.5, 3.0, or 0.8? All right, revealing the correct response in 3, 2, and it would be D, 0.8. So the therapeutic range for an INR when a patient has a history of atrial fibrillation is 2 to 3. So we need their blood thinner than other who may not have atrial fibrillation, because we know with atrial fibrillation, with the heart quivering, that person is predisposed to developing blood clots that can travel. So their INR level has to be higher than yours and mine. So their INR level would be 2 to 3. An INR level of 0.8 indicates that this patient has probably not been taking their medications, and or maybe they've been sick and they've been vomiting, and so they've not been able to hold their medications down. So you definitely notify the patient of the INR of 0.8. The INR of 1.2, that was marginal, but this one is definitely more critical given the patient's condition of AFib. Question 38. A nurse notices a patient's central line site is red and tender. The patient has a fever. What should the nurse do? A, apply a warm compress. B, flush the line. C, notify the provider and obtain cultures. Or D, restart IV in another site. So here at our location in Jacksonville, Florida, we do have the IV therapy courses for nurses and also for new grads, in which you'll learn about PICC lines, of course, peripheral lines, and also central lines. And so everybody, the answer to 38 is if that central line site is red and tender, you're calling the doctor. It's going to be C, because redness, tenderness, and fever suggest a possible central line associated bloodstream infection. We call that CLABSI. The nurse should notify the provider immediately, obtain a blood culture, and some facilities will allow the nurses to remove the central lines, others will not. So whenever the doctor comes in to remove the central line, your job as the nurse is to snip the tip. You'll be cutting the tip so that we can actually get a culture to identify the organism that could be growing there. Early indication is critical to prevent sepsis. Remember, the central line is in a large vein. All right. So if that's infected, that means that their bloodstream could also be infected. And so the other answers, a warm compress is inappropriate as it may worsen the infection. It would not be B, because flushing the line could dislodge bacteria into the bloodstream, increasing the risk of systemic infection. And it would not be D, because we're talking about a central line. So if this person has a central line, more than likely, for whatever reasons, either they are on maybe like TPN, where we can't administer TPN through an IV. It has too many electrolytes in it. It's going to irritate the smaller veins. So we need to get this person another central line. Restarting an IV at another site is not appropriate without first addressing and assessing the suspected infection in the central line. Plus, again, if they're on TPN, the next course of action would be for that doctor to either have a PICC line placed or to get another central line inserted as soon as possible. Question 39. A patient on digoxin is found to have a digoxin level of 3.2 and is experiencing visual disturbances. What should the nurse prepare to administer? In other words, if a person is dig toxic, what are we going to administer? Would it be vitamin K, atropine, digoxin immune fab, or digibind, or would it be sodium bicarbonate? Right, and this should have been an easy one for you. If a patient is dig toxic and they're having visual disturbances, which is definitely a sign, we're going to have to give the antidote. So the antidote to digoxin is digibind. Your therapeutic dig levels are 0.5 to 2. Therefore, a level of 3.2 with symptoms such as visual changes, sometimes they'll see halos, yellow circles around objects, and nausea, all of which indicate dig toxicity. And of course, the antidote would be digibind or digoxin immune fab. Question 40, and we're going all the way to 50. If you stayed with us this long, give this video a thumbs up. Don't forget to share our video and our channel with your friends, family members, and also your nursing students. So question 40, a nurse is caring for a heart failure patient on furosemide and digoxin. Okay, so in addition to having heart failure, if they're on dig, they also probably have atrial fibrillation. Which lab value is most concerning? Okay, so would it be a potassium of 4.2, a potassium of 2.9, a sodium level of 137, or a dig level of 1.6? That's right. We've been going over these lab values, and let's see how much you remember. Let's see if you actually took notes. It would be B. Yes, that potassium level of 2.9. Your patient's hypokalemic, which increases the risk of DISH toxicity. A potassium level of 2.9 is critically low and may lead to life-threatening arrhythmias when combined with digoxin. All right, everybody. I thought we were going to 50. We're only going to 40. But either way, thank you all. You've been here for, at least close to an hour. So I hope you learned a lot. Again, please like the video, share it with others. And if you've not done so, subscribe to our channel. Thank you for watching, and I hope you learned a lot. I will see you in